Do you need to be worried about going blind if you're on Ozempic and Wegovy? You've probably heard some recent reporting about a study in JAMA Ophthalmology, a journal of the American Medical Association, that was released earlier this month by a group of doctors and researchers from Mass Eye and Ear, an ophthalmology and otolaryngology specialty center within the Mass General Brigham Health System out of Boston, Massachusetts, that found a possible link between semaglutide, which is the active ingredient in Ozempic and Wegovy, and a very rare eye condition called NAION, which stands for non-arteritic anterior ischemic optic neuropathy. This condition can cause sudden, painless vision loss in one eye due to restriction of blood flow to the optic nerve. As a result of these news reports, some folks are asking if they should be concerned about this potential risk factor, and some are even wondering if they should continue to take semaglutide, Ozempic or Wegovy, or not. I personally believe it's way too premature and unnecessary for anyone to panic about this remote and rare risk factor. And here's why. As a doctoral candidate myself, I've had some training in research methods, and in looking at this study, while worthy of due consideration, there's a lot of limitations to the data collected and the conclusions some media outlets are drawing as a result of that data. Limitations that, honestly, even the researchers themselves recognize in their paper. If I've learned nothing else from my doctoral training, I've learned that correlation does not equal causation. Meaning, just because two factors seem to have a statistical association to each other, in this case, semaglutide and incidence of NAION, does not mean one is the cause of the other. It's data to pay attention to, and most importantly, study further, with a more controlled population and a more complete set of data. Let's take a look at why the picture provided by this one study is a limited one. First, a little context might be helpful. The driving force behind the study was the anecdotal observation from doctors within the Mass Eye and Ear specialty practice that a number of their patients being treated for NAION had been prescribed semaglutide to treat type 2 diabetes and/or obesity. This caused the doctors to conduct a retrospective study of the records of over 16,000 former and current patients who had been referred to their neuro-ophthalmology clinic for presumed conditions that the clinic treats as a specialty. The study found an increased risk among their sample population of more than 4 times for patients with type 2 diabetes and a semaglutide prescription, and more than 7.5 times increased risk for patients with obesity and a semaglutide prescription. However, it's important to note, and the researchers acknowledge this themselves, that their sample population consists exclusively of people seeking specialty medical care, specifically for vision-related conditions. And therefore, the increased risk can't necessarily be applied to a more general population of prescribees of semaglutide. The researchers also acknowledge that their study didn't allow them to confirm if those individuals whose records were studied actually took the medication, or if they were taking the medication at the time of their NAION diagnosis, or the onset of their symptoms. Nor were they able to ascertain if the association with NAION could be connected to any particular dosage of semaglutide. Finally, it's very important to note that prior studies of non-arteritic anterior ischemic optic neuropathy, or NAION, indicate that risk factors and associations include things like hypertension, diabetes, obstructive sleep apnea, and obesity, all conditions and/or comorbidities that are common among patients being treated with GLP-1 medications like semaglutide. So the question remains, is the increased risk observed by these researchers due to the medication or circumstantial due to the overall health profiles and their existing NAION-associated risk factors? The answer is further study is needed, and the current picture painted by this one study is simply incomplete. So the question at hand is, do I need to be worried about going blind if I'm on Ozempic or Wegovy? Well, we know that obesity and type 2 diabetes are diseases that present numerous, well-documented health risks, including health risks that can markedly shorten your lifespan. Semaglutide has been studied since at least 2008 when phase 2 clinical trials began and has been actively prescribed following FDA approval in 2017. Study after study has been released identifying the positive benefits of GLP-1 medications, including decreased risks for multiple types of cancers, cardiovascular diseases, and even sleep apnea, to name a few. So, with any medical treatment, including potentially life-extending medical treatments, we must always weigh the potential risk factors against the potential benefits and make an individualized judgment for ourselves. What I would say is that until this potential but very uncommon risk factor is further evaluated and studied, there's really no need for immediate alarm. But with any prescription medication, you should discuss all risk factors with your medical provider. Be honest and upfront about any health conditions or other medications you're taking with that provider so that they can help you to evaluate your own risks and make sure you're monitoring and discussing any new or unexpected side effects with your medical provider. For now, I'm choosing to monitor the ongoing studies of both the benefits and risks associated with these medications. And I'm not letting the media hype cycle discourage me from taking control of my health and well-being with the assistance of a GLP-1 medication.